Well, hello again. This is Dr. Lenz, and so we're moving along in the course. We are making our way up to the fourth module here, which is, by the time we finish it, is the halfway point in the class already, which is pretty amazing. And so with this module, we switch gears a little bit. And hopefully what we're going to do is challenge your notion and way of thinking about health, illness, disease, lifestyle, with the piece that we're going to read for the next couple of weeks, the next 3 weeks actually. So the book we're launching into now is Lifestyle in Medicine. It's written by two medical sociologists from Australia. And I'm just going to make a generalization here, and I could be off the mark, but I don't think I am. But that most of your training or view of health and illness is from a biomedical standpoint. Certainly, if you're a healthcare provider, this has probably been a healthcare provider that has been trained in the United States. This is probably what your viewpoint is largely biomedical, largely reductionistic in nature. And what we're going to do purposefully is switch gears a little bit and challenge that notion of what perhaps health and illness and disease and how lifestyle fits into that is related to how you internalize a material, how you live your life, how you practice, perhaps in whatever career field you're in. One of the things that's interesting about this, well, before I go there, the purpose of putting this book into this course is to lay some foundational concepts for you. If this is the first time that you've read material that is really social science based rather than natural science based, it's going to take you a little bit longer to get through the book. So read it slowly. It's okay. If there's terminology that you're unfamiliar with, look it up and just try to consume this information as best you can, because it's going to be challenging perhaps in a couple of ways. Partly is through some of the concepts and terminology, and partly because it's going to be different than what you've read in the past or studied or maybe even thought of for how we approach health. And that is also to say a lot of this is theory-based as opposed to application-based, which we're very much used to in biomedical. The biomedical world is reading facts and then applying them, as opposed to reading theory and reflecting on them and seeing how the theory then fits into how we may practice on a day-to-day basis. And so that's what we're getting to on this, is to lay some theoretical foundations for how we approach lifestyle and how lifestyle then fits into our own concepts and notions about what health means, what illness means. So it's interesting. So what you are assigned here for this module is introduction and chapters 1 and 2. And I really like the way Hansen and Easthope start the introduction by asking you a question. This is how we approach this whole program, is internalizing this, because everyone has to deal with their own lifestyle. Everyone has to deal with their own health on a day-to-day basis, especially with regard to lifestyle behaviors on what you should eat and what you shouldn't eat. Should you go to bed when you're supposed to, or get enough sleep, or manage your stress, or get some exercise, or not smoke, or not drink too much, that kind of thing. So everybody makes those decisions, and this is why what we focus on in our program, and they start off by asking the reader to think about some things, to answer questions yes or no. Are you too fat? Do you smoke? Do you drink too much? Are you physically inactive? And so you answer those questions for yourself, and then they follow this up by, if you answered yes to any of those questions, do you feel guilty about it? And if you answered no to any of them, do you feel smugly superior? And this is important for us when we're doing health coaching. Uh, what we've been trying to get to so far in the course is really digging deeper when you're coaching with someone on a one-on-one basis. Not just saying to everyone, you need to eat better and exercise, so go do this for physical activity, just go eat this, buy this at the store, that kind of thing. But getting to the root cause of why people eat the way they do, have a level of activity as they do, sleep as much as they do, and really pulling back layers and layers to get to the root cause. But something important to understand is how people feel about that. And this is one of the approaches to this book is, and you can internalize it for yourself. If you're overweight, do you feel guilty about it? If you smoke, do you feel guilty? If you smoke and don't feel guilty, are you smug about it? Do you feel smugly superior? If you exercise for an hour a day, do you feel superior to others because you exercise more? If you are of normal body weight, do you feel superior to others because of that? And that really is an important concept to get to when we're trying to establish this relationship with other people and establish healthy lifestyle behaviors. So then as the book progresses on, there's some theories that are introduced, relationship to lifestyle being a medical explanatory model for health, illness, and disease, and how that relates to our other explanatory models for health, illness, and disease. And those concepts are very anthropological in nature and are important for us to get introduced to them. It's not something that we go into to any great depth in the program, but it's very important for us to have an understanding of some of those anthropological concepts as we're working with people on a one-on-one basis, because understanding the baseline theory is of some of these concepts is very important. So I hope the book challenges you in many ways, but I hope it challenges you in the way you look at lifestyle. And perhaps your view of lifestyle is very much in the biomedical context, in that we look at lifestyle, taking, for example, exercise, and looking at exercise very much from an exercise physiology standpoint, and what that does for us to manage blood pressure and body weight and reducing risk for cardiovascular disease. But it's much bigger than that. Lifestyle is much bigger. We define in our programs here at Creighton, we define lifestyle very broadly, and it's not just in the biomedical context. And this is what I hope this book exposes you to. So if you're used to thinking about health and illness and disease very reductionistically, this book is going to be a good read, because hopefully it will open you to perhaps an understanding of the interconnectedness that lifestyle has from many areas that go into making each individual whole. And so when we talk about whole person health, these concepts are very important for us to get a baseline understanding and something for which we can grow from as we move forward and apply then other courses that you will take specifically in exercise and healthy eating and stress and sleep and so on. So I'm really looking forward to the discussion of how this goes on here. So again, try to make notes and highlights and look things up if you don't understand them. And then when you get to your discussion with your peers, ask questions. Anybody understand this? And we'll all jump in and try to have a lively discussion about the concepts. If there's something that challenges you that you disagree with, call it out. Let's talk about that. If there's something that really resonates with you and say, "God, this just really makes sense," call that out too, and we can have a discussion about that too. So best of luck on the reading, and I'm looking forward to the discussions as always. And keep up the good work, everyone. Class is going great. Thanks.